So in this series of videos, you're going to hear a few people's experiences of living with lymphedema that has been caused by the unavoidable treatment for their cancer. And they're willing to share what it's like living with that chronic condition and some of the problems they have to overcome. My name's Mark Pearson and I am an MLD therapist, which is Manual Lymphatic Drainage Therapist. And I'm the primary and paediatric lymphedema clinic coordinator at St George's Hospital. I think before you know what lymphedema is, it's just important to recap what the lymphatic system is. And the lymphatic system is a series of fine network of tubes, some only 1 cell thick, that collect fluid in the body and transport it back into the bloodstream. That's when it's working very well. The lymph system looks after the balance of fluid in the body, also is an immune surveillance tool, so it lets the immune system know when there's a problem. And it also deals with the balance of fat and hormones as well in the body. So when that lymph system isn't working and the lymph transport is broken, that's when lymphedema happens. And lymphedema is a collection of fluid under the skin that is chronic, doesn't respond to any medication like diuretics or anything that any creams that can be rubbed into it, because that fluid is stuck under the skin, and left over time it can become quite hard, it can become fibrous, and you can get shape changes. People tend to think it's with arms and legs, but wherever you have skin you have the potential of getting lymphedema if the lymphatic system isn't draining properly. The initial signs can be quite varied, but some people describe a heaviness or a feeling of dragging. They can sometimes interpret it pins and needles, altered sensation in that area where the swelling could be coming. Before they see a shape change, if they're going to see a shape change, they'll feel altered sensation, some kind of feeling of heaviness or dragging in that area. That's what they feel first of all. If that's not dealt with, then they will start to get a progressive build-up of fluid, and they'll start to see shape changes where the limbs and the body part starts to change from normal shape. So it's important to know that there's no cure for lymphedema once that lymph system's broken for the unavoidable treatment they've had for some of their cancers, that it can't be repaired, it can only be managed. So the cornerstones of lymphedema management that we advocate are good skincare, compression, weight management and physical activity, and we encourage our patients to embrace to further manage their lymphedema so that it doesn't become problematic and it doesn't affect their quality of life more than it should. So the psychological aspect of having lymphedema can never be guessed or estimated. Some people think because you can hide the body part, for example if it's your leg, you could just wear a pair of baggy trousers and you don't need to worry about it. But the psychological aspect is always relevant to that one person. There are various patients that I know that won't engage with certain employment because of their swollen body part, and others don't care. It is a range that you can never second guess, but something that we always try and make clinic time to nod towards, because we do appreciate that having lymphedema can have huge repercussions in your self-esteem, relationships, quality of life, employment ability, that kind of thing. The 3 tips for people with lymphedema, I would say, is to watch your weight. The biggest influence we have on managing fluid is your body weight, and we can prove statistically that the higher a BMI, the more difficult it is for that lymph to be managed wherever it is. And secondly is skincare. We need to be making sure that these lymphedema areas are not putting our patients at risk of infection, because the lymph system lets your immune system know that there's a problem. So when the lymphatic system isn't working properly and there's a cut or a gnat bite or an opening in that area that's swollen, there's every chance that it can progress to something called a cellulitis, a bacterial skin infection that will need antibiotic cover before it becomes too progressive. The other 3rd tip is to keep moving. Our biggest problem is for patients that don't engage with physical activity, because the muscle pump system in the body moves the lymph system. The lymph system doesn't have a pump anyway, it relies on movement to be moved about. So sitting with your legs down instead of elevating, for example, can make all the difference for someone who's not able to move as much. But we encourage exercise as much as possible. There's two types of lymphedema that we know is primary and secondary lymphedema. Primary lymphedema means that the person is born with an inherent weakness in the lymphatic system. It may display at birth, they may be born with a swollen body part, or it may happen after a year of life. So late onset primary lymphedema, and that means that genetically that lymph system was always going to go without any particular cause. The other type of lymphedema is secondary lymphedema, which is, most people think of cancer-related lymphedema, but that's where the lymph system is inherently healthy, it's fine, but it's been interrupted, it's been damaged by something. So radiotherapy, surgery, a tumour could even do it itself. But other things like immobility, infection, overweight can also have a bearing on the lymph system and cause lymphedema.